Hi, it's Dr. Eric Balcabbage, and we're back for another edition of Thyroid Thursdays. And today we're going to talk about the difference between primary hypothyroidism and what I call thyroid hormone dysregulation disorder. So what's the big deal? What's the difference? Why do we need this other term? Well, if you've watched some of my previous videos, I explained to you that traditionally what most practitioners are looking for is primary hypothyroidism. The doctors want to find out, is the gland actually making T4? And so if TSH is high and T4 is low, the gland is not making T4 appropriately, and that is termed primary hypothyroidism. That's what most people are being treated for. However, many people have hypothyroid symptoms, and they make plenty, and their TSH is normal, they make plenty of T4, but there's just problems downstream from there. So somewhere between the T4 being made, the T4 being converted to T3, and T3 actually binding to the receptors in the cell and actually being used, there are one, two, or more problems. And that is not primary hypothyroidism. As long as you're making T4, then technically you don't have primary hypothyroidism. And many times people will get dismissed or be told there's nothing wrong with their thyroid because they don't have a high TSH and a low T4, that they're not primary hypothyroid. And technically the doctor is correct. So what do you have? What can you tell your friends and your family is wrong with your thyroid if you have all these hypothyroid symptoms and you're not primary hypothyroid? Well, if you've watched a couple of the other videos, we talked about other patterns or other ways that thyroid physiology can break down. You could have hypothyroidism secondary to pituitary hypofunction. You could have thyroid overconversion, thyroid underconversion. You can have elevations of thyroid binding globulin. You could have thyroid resistance. So there's multiple patterns, and you can have more than one of those patterns, and that's kind of hard to remember, and it's maybe hard to explain to somebody. So I think this new term that I've come up with called thyroid hormone dysregulation disorder kind of just explains it. There's a dysregulation in your thyroid physiology, and that's what's wrong with you. And so simply put, yes, I don't have primary hypothyroidism, but I have a thyroid hormone dysregulation disorder, which simply means that there's somewhere between T4 being made and T3 binding to the receptors and getting into the cells, there's one or more problems. So hopefully this will give you something to kind of hang your hat on, that, hey, I do have something wrong. You don't have to remember a bunch of pathways or a bunch of physiology. Just remember this term, thyroid hormone dysregulation disorder. That's what we'll call it, okay? So if you have any questions, put them below the video. You can always call my office, 610-558-8920, if you have any questions regarding thyroid function, thyroid physiology, autoimmune thyroid called Hashimoto's thyroiditis. Feel free to give my office a call with questions, or if you would like to schedule an appointment. All right, take care, and look for another Thyroid Thursday next Thursday.